Good evening, everyone. Hi, thank you so much for joining us here tonight at Nobu. What an amazing and glamorous backdrop for our conversation on all things to do with finding confidence. We're so joyed to have all of you here tonight. And for any of you I've not yet met, I'm Francesca Ogiman-White, and I'm the founder of the Beauty Triangle. We're here tonight to talk about how to find confidence. After all, I'm sure we can all agree that over time, confidence is something that starts to become a little more elusive, whether that's due to breakouts, skin disruption, maybe changes that we're experiencing with our bodies, with hair loss. It's something that can have a huge impact on our self-esteem. So, what are the most reliable routes to finding new strength when it comes to our skin, our bodies, and our hair? And crucially, how can we build upon our self-esteem? Now, we're going to be coming to address this question very soon with our amazing lineup of speakers, but a little bit of background on the Beauty Triangle just before we get started. We established TBT as a way to educate and also empower our audiences on all aspects of their health and well-being, and always from a holistic standpoint. However, we also did it to introduce you, our audiences, to the most trusted and authoritative voices in the world of well-being. On that note, it gives me great pleasure to introduce you to our very esteemed lineup of ladies who we have here tonight, starting with surgeon, advanced injector, global thought leader, Ms. Jonquille Chantrey, breast surgeon and fat transfer extraordinaire, Mrs. Jacqueline Lewis, and finally, trichologist and founder of the hair growth clinic, Hannah Gaboardi, who also has a residence here up at Nobu, which is highly exciting. You must go and check it all out. I'm going to hand over to them to say a little hello just before we get started with the main conversation. But just a few things to add before we do crack on. We'll have our normal audience Q&A at the very end, so if you do have any questions, please save them until the end and we'll come to those. We have an amazing goodie bag for everyone with some hair supplements from Viviscal, which we would love for you to try. They're amazing, so highly rated. And you should also have found a program on your seats that has information on all of our speakers here tonight, as well as a referral card. So if you'd like us to connect you with anybody that you hear speak here tonight, just leave your name, leave your email, tick the box next to their name, and we will do the rest. So that is it from me. I'm going to stop talking and hand over to these lovely ladies to introduce themselves. Jonquille, maybe you'd like to start us.
Thank you, Francesca. Good evening, everybody. And I'd really like to very sincerely thank Francesca for this invitation tonight. I've been working with Francesca for many, many years, and we've got a very strong friendship and relationship. I love this topic around confidence, and I'm excited to see where our flow will go with that this evening and see where we go. So I'm actually based up in Alderley Edge. It's in Cheshire, just outside of Manchester. But as Francesca said, I spend a lot of my time travelling. I've worked on 6 continents, speaking, developing different beauty science, injectables, skincare. I consult for some of the biggest companies, as well as advancing scientific breakthroughs. So I have lots of different interests: the psychology of beauty, the mathematics of it, multiculturalism, and the individualism of really bringing out an individual's empowered state. For me, the injectables is the easy part. And as a surgeon, when I trained, I still always have the precision and that perspective in my background, but it's a much bigger perspective that I really try to bring. So yeah, I'm delighted to be with you tonight and very open to all sorts of questions.
Thank you, Jonquille. I'm so thrilled to have you here. My microphone is doing something weird, or is that just me? Anyone else hear it? Okay. I'm going to try and not speak so loudly into it. Jackie, over to you.
Hi, I'm Jackie Lewis. I'm a wife. I still am married after 31 years.
We need all your secrets. Tell us immediately.
I am a mother. Thank you, daughter, for coming to the audience today. She's one of them. The other one is studying really hard for her further degree. I am a simple surgeon. I did spend a long time training in plastic surgery after general surgery. And because my mother had breast cancer, I then became a breast surgeon as well. and a cancer surgeon and a reconstructive surgeon. So I admire you because you go out and teach everyone about it. I'm still just drawing the lines and cutting along the lines and then just stitching everything up.
But that is really simplifying what you do. I think there's a huge amount of, I always think with surgeons, you know, you're part counsellor, you're part artist, you're part mathematician. Anyway, this is your thing to talk about, not mine. I'm going to stop.
My favourite is fat transfer because I know we have this love-hate relationship with fat. I have had one all my life. I've never appreciated my body until I had my injuries. So now I thank my body when I am able to walk without pain and do handstands. So yeah, I appreciate my body now. But I've had surgery myself where bits of fat of me have been transferred to other bits. And one of my specialties is fat transfer. So we'll talk more about that.
Thank you, Jackie. I cannot wait for that conversation. And finally, Hannah, who is our amazing trichologist.
Hi guys, my name is Hannah Gaboardi. I'm a trichologist and I've been in the hair industry for 15 years. I treat very complex cases of alopecia every day. I do a day of charity a month for cancer, for women struggling with cancer and trying to regrow their hair. My clinic is actually upstairs in the hotel, level 2, so you should come and hang out and try. We do iron infusions, PRP, mesotherapy, exosomes are coming. We also have doctors and surgeons that work with us as well upstairs, so come and check it out.
Thank you, Hannah. And exosomes are definitely something that I feel we're going to be touching on a bit tonight. So there's our lovely lineup of ladies. They're all brilliant and such a power panel, and I'm so delighted to have all of you here tonight. But I'm going to start with the amazing Miss Jonquille Chantrey. She has introduced herself already, but what I think is especially unique about Jonquille is the way that she really deep dives into the patient's psyche before even administering any treatment, beautiful as that is. But maybe, Jonquille, you can start by setting the scene. I mean, what effect does confidence have on the women that you see on the day-to-day? What does it do to our disposition, to our posture, to our presentation?
You know, starting from a positive standpoint, I see patients come in all day, every day with such extraordinary self-confidence, head held high. They might be very clear as to their goals and their motivations. They might have a real strong sense of self. But where is that coming from? Is it coming from, you know, as a Maslow hierarchy of needs, is it coming from a very supportive network where they've started, you know, from a childhood, from a partner at home, from, you know, an exciting career or a wonderful family that they've built? There's all these different subtle elements that incorporate this, right? And so that's on a very positive standpoint. And then I see patients who come through who are much more vulnerable. As you know, I treat a lot of patients who have facial deformity, be through secondary to trauma, they may have been born with deformity, significant facial scarring and burns patients, but also on the non-deformity side of patients as well, where perhaps they have been through psychological trauma and social trauma and just life has worn them down. And we see that, you know, there's a lack of eye contact, or there's a sense of vulnerability and self-consciousness.
And you have to be so mindful of that as an aesthetic practitioner, don't you? You know, these people, you said it yourself, they're very vulnerable, and you need to make sure that the hand-holding element of what you're doing is really up there.
Yeah. And so as part of my consultation, you know, I sit back, and it really is, I try to create a safe space for just an open conversation, to try and encourage people to think about why they are here with me. For me, I was thinking about confidence as a definition, as a statement. What does it really mean? And one of the things I liked as I saw was a true sense of self, you know, really understanding who we are, and
taking ownership over that as well.
Yeah, and you know, it changes over time. I think if we define ourselves by how we were when we were in our 20s, our 30s, as teens, whatever, things change, and that's okay for things to change and adapt. And as you know, something that's very close to my heart is something called One Beauty Project that I launched. So in my clinic, I have a studio where it's a self-development studio, and I trained also as a yoga teacher and just from a personal perspective. And my first degree, I majored in neuroscience and psychiatry. So for me, mental health has always been an extremely important part of my practice, but my own self-development journey. So when I sit with my patients, it's always about helping them to balance out self-acceptance versus self-improvement. And I think that is a big part of what confidence means today.
I think that's so beautifully explained. I couldn't have done a better job myself. A lot of patients come to see you from a perspective of wanting to sort of get their skin under control, get their complexion sort of back to a place where they feel confident about it again. Do you see sort of skincare concerns, skincare disruption having a detrimental effect on confidence nowadays?
Most definitely. And one of the big global studies that I was a part of, we looked at 54,000 patients worldwide. It's a lot of patients from multiple different countries. And one of the primary reasons for people to present to the clinic are things like eye lines, crow's feet lines, eye bags, looking tired. Might seem obvious, but the eye area is one of the first areas to see signs of aging. And
it's one of the first areas that we notice ourselves looking in the mirror.
Yeah, and that's because, of course, the skin around the eye is significantly much thinner than other areas on the face. And so that might be a presenting complaint, and we saw that from the studies that was an area of concern. Aging may bother some people, and it may not bother others. And I absolutely applaud the people who it isn't affecting. Because I think in today's society, I know that we'll probably touch on this because this is something that we both feel strongly about, is ageism. And as we progress, as we get older, how we are judging ourselves and how we're feeling judged, that really brings a part of that. But I know we'll touch probably on that later.
And it's interesting because you mentioned it earlier when you were sort of introducing the topic, but I think we do. It's almost that confidence starts to elude us as we age for various reasons and sort of various anxieties we might have. But we also, on the flip side, do grow in confidence. Professionally we become more capable. Perhaps we start families, enter sort of significant relationships. We really do learn to weather life's ups and downs, and that can foster an extraordinary sense of resilience. So it's almost sort of finding that fine balance between the parts of us that we don't like as much, and also celebrating the parts that we do. And I think you sort of summarised it so beautifully. So I think sort of hats off to you. But tell us a little bit about where the injecting comes in, because you have some incredibly advanced injecting techniques. And as much as it's about understanding and unpicking what the patient wants sort of in your consulting room, it's also about helping them to rediscover that sense of self and possibly even feeling more confident when they look in the mirror. How do you go about sort of even deciding where to start?
So the first thing I like to do is ask somebody, what do you like about yourself? I'm not here to pick holes in somebody, and I think that within this industry, I've been in the industry for over 16 years. It's a huge booming industry, and it's changed and evolved rapidly to a point that we couldn't have believed it would have become. But there's a lot of people who really monopolise on that, quite frankly, and take advantage of people's low self-esteem. So that's not how I work. And so I'll say, tell me 3 things that you actually really like about yourself. And I know that over the years, a lot of patients have just sort of sat back and thought, this isn't what I was expecting to kind of have a question posed to me like this. So
and I bet a lot of people come in with their list, don't they, the things that instinctively they want to tell you they dislike. So it's fantastic to flip it in that way.
Yeah, and actually a lot of my patients, I think I'm very fortunate with, because they're very open-minded, they're very well researched, they're very well considered, and they're highly discerning types of patients. So they're very open to this conversation as to a little bit of a deep dive within themselves, but what's your perspective? What's my perspective? Rather than just projecting what they think they need upon me, and I will listen to them, most definitely. So we are a group of, I'm assuming women, I don't mean to assume, but I do treat all genders, and I have been in an extremely privileged position. So I have had my own practice for over 13 years, and I've been lecturing and working in this industry for over 16 years. And over that period of time, I have treated patients who started seeing me at 45 and are now 60, who were 25 and are now 40. They have gone through such significant life changes where in their 20s they never would have thought that they would be invisible. But then now they're 40 and they might have been getting divorced, or they've gone through breakups, or they've gone through very significant career changes. And they're starting to feel invisible, and then the perimenopausal elements start to show, which is, to your point and to your question, what are one of the common things that are coming through the door? And it's perimenopausal signs of skin aging.
And it's interesting because I think we're having more and more conversations now about the menopause, about the perimenopause. It's something that obviously we're so much better tapped into, and that is completely fantastic that it's starting to be recognised in a more public sphere. But it absolutely does have an impact on the patients who are coming to your door, doesn't it? And not just how physically they're presenting and manifesting and what their skin's doing and what's going with their collagen, but emotionally how they feel and how they're weathering the day to day. So it's a very interesting cohort of patients.
This is a huge topic, and there's a real fluency around this, and I think that it's very important that women are starting to talk about it, because, like I said, 15 years ago it was still a taboo subject, and it's important that it's now in the spotlight, but at the same time it has to be evidence-based.
Agreed. And interestingly, I suspect it will come into all of our conversations tonight, and not least because we're talking to an audience of women who are going to be sort of coming up against this, if not already.
Mm-hmm. And this is something that I'm seeing so frequently, that patients aren't realising that it's perimenopausal signs. They're describing other forms of symptoms, general systemic symptoms, how they're feeling psychologically, how they're physiologically feeling, how their performance is changing, both in terms of lifestyle, sports, at work, in family life, how they're feeling with their partners. All of these things are coming in, but then they might present to me with fine lines. Perioral upper lip lines is one of the earliest signs as well.
Really, that what we would commonly call smoker's lines, which can affect us even if we've never touched a cigarette.
Most definitely, and it may present itself because we have a chin that sits back, or we have just these fine lines that start because of smoking, but most commonly it's also because of perimenopause. So starting to see that. Female adult onset acne is a big complaint.
Because again, hormonally driven, acne can hit us at any age and stage of life now, can't it? It's not just the precursor of those teenage years and puberty.
It really can, and there's many patients who never really had acne as teenagers.
That's so true, and then they don't know how to handle it in adult life so much.
Yeah, they're really surprised, and we've seen a significant increase scientifically in this presenting, and it's also because of stress. Dietary factors. Stress has a profound impact on our skin and, of course, on our microbiome. And so the microbiome of the gut, our gut health, and the relationship between our gut and our brain axis and our skin axis are all very intimately related. So these are things, again, that I speak to my patients about. If I think it's beyond my remit, then I do refer to an endocrinologist as well and work with another team of experts. But the dietary components, the lifestyle components are all extremely important.
And I think it's really nice because you've spoken about that skin, gut sort of axis, but also what it really sort of reminds me of is the importance of just understanding ourselves, getting to know our bodies, getting to know our skin, understanding what makes us tick, getting to know our cycles, understanding when we're on that sort of tipping point of perimenopause or menopause. And I think, a lot of the work that you do is really guiding patients and helping them to sort of be more in tune with their body in whatever way or shape that sort of takes us. you've also done some very, very important and powerful studies into what beauty means to us today. Jonquille sort of authored and sort of pioneered some really interesting research into social and cultural and ethnic sort of ideals of beauty, which are fascinating to sort of learn more about. But you mentioned the invisibility of age, and I'd love to sort of unpick that a little bit more, because is that something that we're going to be seeing more and more of as we live longer and as our health span gets ever sort of enhanced and increased? Is ageism going to be something that we're coming up against more and more?
I think that we've come so far in the last 3 years when it comes to multiculturalism and a conversation around that, around gender, around general levels of minorities and giving minorities a voice. But I think one of the biggest things that we're going to have to tackle is ageism. And I find it it might sound very strange in the job that I do. So for me, it is never about vanity, it's never about the superficiality. I say to my patients on a very, very frequent basis, and I have patients from all different walks of life, economically, culturally, etc. I say to them, I do not want you spending a lot of time in front of the mirror, wasting your time. I've also done studies in this, and we've shown that with the right levels of intervention and support, then there is a significant reduction in time spent in front of the mirror and concerns around a self-image. So for me, that's my job. I take that on, and as I said before, for me, I don't find that the difficult part. I think it's a complicated element in many ways to really bring out somebody's individual beauty according to their motivations, their natural anatomic state, their mathematics, etc. But a truly, truly brilliant doctor will be able to just do that. But it's really around this other element. And what is the world that we're living in? I treat a lot of patients who are going through very different life challenges. And as a gender, I think, we know that female empowerment has significantly risen. It's continuing to rise. And how is the world around us responding to that? I know that I have faced different prejudices around ageism. Earlier on in my career, I was too young to have the voice. I was too young to have the gravitas. And then suddenly you're kind of too old, personally. And I've seen this as an observer with my patients and with my friends, that journey that women primarily have been on, and we are still, there's a huge, huge battle to face. And, people will say to me, is it really a part of equalism, feminism, the work that you do? And when it's done right, when it's done in a truly empowered state, I think it is.
I couldn't agree with you more. What does that sort of empowered state look like to the patient who sits in front of you? How do you even get them to a stage where they are feeling empowered? How can you flip their narrative or that internal dialogue so that they can start to see themselves through that lens and then sort of be in the right headspace and the right place for treatment? Because we all know that actually it's about being in the right frame of mind often to even embark on this journey.
I think two words that come to mind are safety and authenticity. Safety has to be an emotionally safe state. So you have to feel in an emotionally safe space. Don't just think that because somebody has great reviews or very popular on social media or whatever, that you're necessarily going to be safe, not just emotionally, but also medically. Are they using the right products that are significantly evidence-based? Are they up to date technically with their ability and their approach? So I think safety has different elements to it. And then authenticity. I always try to gently encourage my patients to understand why they're there, what they're really trying to achieve, and not just in the short term, in the midterm, but also in the long term, because we need to have a longer vision on this. And that's always that viewpoint that I have, is it's not just a quick fix with my patients. It's a journey, and I see it as a privilege to be on that journey with them.
I totally agree. I think a journey is exactly the right word, and I often think sort of the beauty in finding a practitioner who speaks your language and who understands your long-term goals and your vision is that you can go on that journey together. And that's got to be the safest and most sustainable way to actually feeling confident and sort of taking back that ownership of yourself in the years to come, because, you know, hopefully we'll all be doing these treatments for a long time and feeling fantastic for a long time.
Yeah, and as you know, I did a huge amount of research and published on why people do what they do in terms of beauty, in terms of aesthetics and in plastic surgery. Some people want to radically transform. They do, and it may be for different reasons. They may see it as a real pathway to success, to happiness, to feeling much more confident at work or in a relationship. Other people, they see it as a positive aging perspective, and they're not fearful of aging as such. They just want to look really, really good for their age, and we hear this all the time. So it's really about supporting that patient and understanding them and knowing that might change over time.
And hopefully it does. I suppose, you know, we want to grow and evolve, and that's sort of the beauty of aging, I suppose.
And that's okay, and I think the big word is permission. You know, we need to give ourselves permission to change, we need to give ourselves permission to transform and to accept. And I think that is the hardest
I
balance to achieve.
I agree. Thank you so much, Jonquille. That was so fascinating and eye-opening. And if you have any further questions for Jonquille, she'll be here at the end. We'll have our Q&A. Thank you, as always.
Thank you so much.
I'm going to skip over to Hannah just because I feel like it would be a good use of our time.
Okay.
Just to keep Hannah has a very important call that she needs to take later, so I'm just trying to make sure we don't run out. No, because I have a real predisposition to chatting, and before we know it, we'll have run out of time. And
No, don't worry.
it's very important that everyone gets their turn to speak.
Thank
Anyway, Hannah is the amazing trichologist based here at Nobu. She does all sorts of incredibly high-tech things for the hair and for the scalp. But I think it's also a really lovely follow-on, because I think you must see sort of women coming into your clinic with all sorts of concerns about confidence that are hair related. I mean, how much of a part of confidence do you think hair actually does play?
Hair is everything to us. It's what makes us feel pretty, it's what makes us feel feminine. And when you suddenly lose your hair, your whole life changes. So say, for example, you woke up tomorrow and you had a big bald patch at the top of your head. You're suddenly thinking, I need to cover this up. I can't go on that date on Friday. I need to wear a wig. Everybody's staring at me. I look strange. It changes everything. And when I meet these women, especially those that have got really complex cases of alopecia, rare cases, it does knock their confidence. So hair is so important to us.
It definitely is. Sorry to interrupt as well. It's those subliminal connotations that hair has as well. You know, it's our youthfulness, it's our fertility, it's our energy. And this isn't just for women, this is for men as well. And I'm sure you see obviously both sort of cohorts, don't you?
There's that thing, good hair day, bad hair day, and it really does affect your mood. When you're having a
100%.
good hair day, you feel amazing.
Yep.
You feel like you can take over the world. So when you lose your hair, it does have a huge knock on your confidence. And I see women with all sorts, with the traction alopecia, where they've had weave for 20 years and they've lost their entire hairline and they're devastated about it because they didn't know any better. Or alopecia areata, which is an autoimmune response, mainly from stress, and it's a patchy hair loss, and can be quite dramatic when it starts. Also, telogen effluvium is the main thing I see, which is shedding, which happens after postpartum, which a lot of women have. And it can be quite scary because you're washing your hair and clumps and clumps and clumps of your hair coming out, and you're like, when's this ever going to stop?
This is always the
Am I
story.
gonna lose my
here.
hair?
Women in
Always.
the shower, exactly, seeing it go down the pocket, or sort of waking up and finding it on your pillow.
Exactly.
And so how do you go about even starting with those patients? Sort of how do you sort of take it back to sort of that foundational approach and really understand what it is that you're going to do to help them sort of with their hair and with their confidence, conversely?
The first thing I do in clinic is we start with a blood test, because it all starts from within. I do a background on what's happened in the last 3 years. Have you had any trauma? Normally it's sometimes trauma, divorce, stress, losing your job, low iron, postpartum again, autoimmune, going on medication, cancer, all sorts.
So you have to be a real sort of investigator in the
Yes,
sense of
so I
understanding
investigate.
what has happened to the patient in their background
Yeah.
and or even recent life. Because how long does it take for a stressful incidental trauma for us to see the results on the hair?
Funny enough, it actually never happens when you're going through stress or trauma. It's 3 months after.
So if
So
you're
you're-
suddenly experiencing
Yeah.
hair loss, you need to look 3 months back and think, what
Yeah.
happened? What was I
Between
up
the 3
to?
months, yeah. And then
Yeah.
normally the client goes, oh, that's why I'm losing my hair, because I just got a divorce.
Yeah.
Or that's why I'm losing my hair, because I was taking that medication.
And it all
Or I had
kicks into
COVID,
place.
or I had the flu. And then we're like, oh, okay.
Yeah, exactly. And are those big things that you're saying, things like illness, like COVID, still sort of impacting on
Massively
hair
long
loss?
COVID as well.
Really?
Since COVID, I've never been this busy in my life.
My goodness.
I'm inundated, as I told you, like 18 patients a day, all with hair loss. Mainly shedding is the main thing that I see, chronic shedding. And it can be anything from coming off the contraception pill, can be perimenopause, antibiotics, it can be many things.
I thought perimenopause would also come into your sort of discussion as well. What are the effects that perimenopause, menopause even have on the hair? Sort of why do we suddenly start noticing these hair-related, scalp-related changes?
It's the aging of the hair as we get older, unfortunately.
Lovely.
It happens to all of us. And your estrogen levels obviously are dropping quite dramatically. And the first sign of perimenopausal hair is a receding hairline. Your hair almost feels a bit dry, a bit brittle. It just doesn't feel quite the same, and your ponytail is actually half the size.
That's a real giveaway, actually, isn't it? As your ponytail gets thinner and thinner.
Yeah.
I can't tell because I just have so many extensions. I keep sort of bulking it up. I guess you've got to wean yourself off the extensions to be able to see these things.
Yeah, exactly.
And you mentioned things like the weaves. I guess, things like hair extensions can actually have a massively sort of detrimental effect on the hair and the scalp over time if they're the wrong ones.
I don't mind hair extensions. I let my clients have hair extensions, anything to make them feel good. But it's when you wear hair extensions for like 10, 20 years and you haven't had a break.
Yeah.
Or if you've had a weave really tight on your hairline, it's causing constant pulling to the hair shaft, which causes scarring alopecia. So I don't mind hair extensions. What I don't like is the glued on wigs. And I'm seeing a lot of online Instagram videos that really upset me, where a client comes into this wig clinic and the patient has a semi-permanent hair loss. They don't actually have permanent scarring, and these CNC wigs are actually it's like super glue. They're gluing it around the hair and then they stick it on top. And then you have to keep going back every month for maintenance, and it's a fortune. It costs
So
them
they lock
thousands.
you in, and they're also
You're locked in.
completely damaging your hair,
Yeah.
your scalp.
Yeah, so that's what I see a lot of as well, which is really unfortunate, is women wearing wigs and they don't actually need to wear wigs. And we take the wig off and we're like, hair's actually really good. Like, your hair's actually fine. Why did you do that in the first place?
Yeah.
Because they don't know better.
And also it sort of comes back, to the subject of confidence. Sometimes we don't feel that our hair is sort of our crowning glory, so to speak, and it's very easy to sort of see things on social media, be seduced, end up doing these treatments that probably aren't beneficial. I mean, that's one of the reasons that we set up the Beauty Triangle, so that we could make sure people are getting really genuine advice from people who really know what they're talking about.
Exactly.
And it's great to hear you say this.
Yes, and also these hair serums and these gummy bears and all these things you see on Instagram that everyone just spends so much money on, and I'm just like, go get a blood test and find out what you're actually deficient in. Instead of taking all these supplements, find out what it is that you're actually deficient in, and then you can find the root cause.
Exactly. Get to know your body, understand what makes it tick, and then you'll be able to be much better armed. And also, knowledge is power. Just understanding these things is the first step, isn't it? Tell us a little bit about the treatments that you're doing then. You sort of, when you did your introduction, you mentioned mesotherapy, you said exosomes are coming. What does the average hair treatment or scalp treatment look like to somebody who comes to your clinic?
Everybody's different. I can't actually say there's like one go-to, but a lot of the time it is iron infusions, believe it or not, because a lot of women are anemic and they don't realise until they have a blood test, even after pregnancy. A lot of my clients are anemic or zinc deficient if they breastfed for a long time. So I do a lot of iron infusions. Well, my doctor does, who works for me. He does iron infusions, PRP, platelet-rich plasma, which is where we take your blood, spin it in a centrifuge, and extract your concentrated platelets and inject it into your scalp. Also, mesotherapy is amazing, microneedling. topical medication, also medication as well comes and plays a big part, and products.
And mesotherapy, just to touch on that, that's a sort of bespoke cocktail normally of different
Yes, of hyaluronic acid,
ingredients.
biotin, growth factors, that we do tiny little incisions all over the scalp to create tiny little micro tears.
And then all of the sort of goodness sort of seeps into the scalp that way. Very nice.
Exactly.
And how many sessions is somebody looking at when they come to start sort of these treatments?
I can't really say because it depends on how severe your hair loss is. If it's quite severe, you probably need about 4 to 6. If it's not too bad, and we can do it with supplements, a blood test, maybe 2 or 3.
Okay, interesting. So again, it's the journey that Jonquille mentioned as well, the hand holding and the going forward together. What are the results that you see in patients? I mean, physically, but also emotionally. As you said earlier, hair is, massively sort of linked to patient confidence. Do you see a transformation in patients on the other side?
Massively. I often everyone always cries in my chair. My PA is here with me. We call it the crying chair.
Oh, bless you.
So they burst into tears as soon as they get there because they're like, I'm losing my hair, I don't know what to do, and everyone's staring at me, I feel really uncomfortable. So it's amazing for me, especially when I get a really complex case of alopecia and they've been around the block and they've seen every trichologist, they've been to every centre, and we start the process of the blood test, the supplements, the topicals, everything, the change of the diet, more iron-rich foods, really looking after them in a whole, I call it a whole MOT that I do. And then they're just bursting with joy, and they're out there, they're dating again, they're going out, they feel good, the wig's off, and they actually send me videos. We've got this thing where I get them to send me videos of throwing the wig in the bin.
Oh my God,
so we do the wig in the bin week, and they send me videos of the wig in the bin, and like, I'm done.
Oh, that's incredible. What a nice story.
Yeah.
Tell me a bit about the supplements, because you mentioned that's a part of the protocol for a lot of women, men, whoever it is that you're treating. What are the things we need to be looking out for? You obviously mentioned the iron infusions, but is there anything else we need to be mindful of?
I would obviously go back again to saying having a blood test to find out what you're actually deficient in, because a lot of these multivitamins, they don't even actually absorb in the body. You have to take them at certain times, so they're a waste of your time. So you need to be having a blood test to find out exactly what you're deficient in, to find the blood tests that work for you. But there is supplements like Vidascal, which I'm the ambassador of, and the reason being is because they've got 25 years of clinical research, they've been around for a long time, they have key ingredients like zinc, collagen, iron, vitamin D, vitamin C that we all need for maintaining healthy hair. Not if you've got a severe case of alopecia, then no supplement is right for you. You need to have a blood test first.
Yeah, and you sort of want to go on that journey with a practitioner who helps you kickstart a bit of a program going forwards, and then use the supplementation from home. Is there anything else from home that we can be doing on the day-to-day to maintain healthier hair, to keep us looking and feeling our best?
Do you know what I found actually today, and I've been recommending it so much? Our water here is so harsh. I don't know if you've realised that.
So true, yeah.
Oh my God. When I travel, I'm like, oh my God, my hair's so nice.
Yes, whenever you
and
go
then
to
I'm
the
here,
States, it's so silky.
And all my clients, especially from the Middle East, they're like, darling, your water's disgusting. And I'm like, I know. So that I found this water filter online that's incredible. And it's just a shower cap that you can put on, and it filters your water, and your hair is so silky.
Yeah, it's
So
such
a
a
water
good
filter
idea.
is such a good idea, by the way.
I remember my husband saying the same when I met him, sort of just being from Germany even, and him going, oh, the water, it's bad for your skin as well. I don't know if you guys
dry.
have seen
So
this.
dry.
Exactly.
Yeah.
And we end up then just slathering ourselves in all sorts of lotions and serums and everything and oils, trying to sort of counteract it. But what a clever idea.
Get
the
a water filter. Definitely.
And what about styling the hair? Is there anything that we should sort of be mindful of, anything we should avoid? I know you said hair extensions are okay if done
If they're
mindfully.
maintained and they're done well. I would say people, when they're losing their hair, they're so terrified to wash their hair. It's actually the opposite. You need to treat your hair as you do your skin. So imagine if you didn't wash your face for like days. It's the same with your scalp. It gets dirty, it gets debris, the follicles get clogged. So it's really about washing your hair 2 to 3 times a week and maintaining a good hair care routine.
Because a lot of that comes down to just scalp health in general, doesn't it?
Yeah.
It's not just about nourishing the hair, it's about letting the scalp, I suppose, breathe. I always think, the amount it can get sort of clogged up with is obviously very detrimental to the hair growth that's coming through.
So cleaning your scalp more, getting good products. Like, don't go crazy and have to get the most expensive product, but research into the products. sulfate-free, very good. More holistic products. Some that, if you have a bad scalp condition, don't use things that have got a lot of perfume inside that irritate the scalp. And just maintaining good hair health, low heat styling as well. We're also, all of us are in such a rush in the morning. We're like straightening our hair really fast, and it's like burning it, and you don't realise that you're actually burning your hair, especially if you have bleach as well, and then you're straightening it with a high iron, you're actually burning your hair shaft. So it's about just lowering the heat, having good hair care routine.
What can you do to undo that damage? Is it literally a case of sort of turning off the electrical appliances and sort of using the right products, or do we need to be a bit more sort of high-tech about it?
We need to, if you've damaged your hair shaft, unfortunately there's not much you can do apart from use a mask that just kind of masks it, patches it up. Yeah. You've got to cut it off. Once that's dead and those ends are split, it's gone. It's bye.
God, yeah, because the hair is essentially... What I always find so interesting about the hair, and I'm sure you see this in your consultations, is it's often as much as we sort of take so much pride in it and it sort of makes us feel so fabulous on the day-to-day, it's also the first sign something is wrong in the body, isn't it?
Yes.
If something is deficient, it shows up in our hair.
Yes, so our hair is actually the last organ in our body to be fed. So it's always feeding off the scraps, even on a good day. So when you don't have enough storage of iron, especially, which I see a lot, low ferritin levels, is normally because the body has nothing to feed off. So it's always feeding off the scraps, even on a good day. So you need to make sure that your levels are okay. So yes, the hair is the first sign.
It's really important. I'm sure there's a link between that and sort of breastfeeding and sort of
100%.
post-baby. If you're breastfeeding, you're not eating enough, you're probably trying to lose the baby weight at the same time. Speaking from
all
experience.
of those things, yeah.
Exactly.
Zinc deficiency is a big thing
doesn't
in
it?
breastfeeding. A lot of women that I see, even with heavy cycles, menstrual cycles, that's when you're more subjected to losing iron during your cycle, and that can make you anemic as well.
You're so right. Final question. How can we go about changing the narrative so that it's... Look, this evening is very much about sort of understanding the treatments, the therapies that are available to make us feel more confident, but it's also very much about sort of reframing sort of that narrative that's going on in our heads. So how do you think we go about doing that? How can we sort of rediscover that lost confidence, even if we're not feeling it on the day-to-day?
I would say it's more about feeling good. A lot of my clients that are losing their hair, we have an online therapist as well that works with clients that pull their own hair out. And they are highly stressed, and the reason why they do it is a habit and stress related, and they pull their hair out. And I always I'm also like a therapist as well. So I always
think all of you are like therapists at the same time. I mean,
yeah.
I'm so calm just sitting up here with the three of you.
So I always try and tell my clients, and I'm always positive as well, no matter how bad it is for them. I'm always always think of the positive. Always think, okay, if I am losing my hair, I can get a fantastic wig. Yep. And I'll be like, I will find you the best wig doctor there is to get you that wig. And it's more about just trying to live with, if you do have alopecia, embrace it. Even my clients that pull their own hair out, I'm like, tell your husband that you're doing this, embrace it. Don't be scared. If you are not if you are taking a wig off, just embrace it. Who cares what anyone thinks? Yeah. Be more positive and just think, this is who I am and this is how I'm going to be.
Yeah. Try and remember the positive and take ownership again. I love that. Thank you so much, Hannah.
Welcome.
That was fascinating.
You're welcome.
And if you have any questions for Hannah, she should hopefully be here at the end as well for a bit of Q&A. So let's save those up until the end.
Thank you.
Now, our final speaker has introduced herself already, Mrs. Jacqueline Lewis. She's always my first port of call when it comes to anything breast-related, anything fat-related. As she explained earlier, she has a real passion for fat, and I think we'll probably find out a little bit more as we start talking. But maybe, Jackie, you can just tell us a little bit about what confidence means to the women who come to your door as patients.
Just before I answer that, to pick up on what you said, Hannah, I went into Anya Heimash, that posh handbag shop on Sloane Street, because I work at the Cadogan Clinic opposite, and we went shopping, my daughter and I, and on one of the shelves was a book, and there was a quote that said, if you're feeling depressed, just go and wash your hair.
Oh my god, that's so good. So true.
So do you know what happened to me yesterday? My car got broken into, my backpack was stolen, all my credit cards in my wallet was stolen. I got up today and I thought, ugh, and I had all my horrible old exercise clothes on. So before I came here, I washed my hair and I put on some colour. And I feel a lot better, thank you.
Isn't it powerful though, the effect of washing one's hair?
Yep.
The power of a good blow dry.
It looks good. You're having a good hair day.
Jackie has amazing hair anyway.
Thank you.
And she doesn't have extensions.
Oh.
No extension, yeah.
You were talking about ageism. Do you know we're all going to live a lot longer than our mothers and grandmothers, and I bet you this, there will come a time when you advertise on your profile on Bumble, you don't mind if they've got money or if they're in a wheelchair, just say, own hair, tick, own teeth, tick. But coming back then to ageism and confidence, do you know what? It doesn't matter. I'm a breast surgeon, so I see lots of breasts. I've seen probably over about 30,000 pairs in my lifetime. I started looking at breasts like every day and doing screening clinics and whatever clinics. So many breasts. So we calculated it's probably about 30,000 since 2001. But anyway, beside the point. We have great role models in Madonna and Helen Mirren, but do you know what? I looked at our late Queen. For decades I thought, wow, you would have such a better posture and your clothes fitter would be able to do so much more if you just had a breast reduction. But no, she had the confidence and she carried those weights on her shoulders. I bet you're all going to look at the pictures of her when you get home, right?
Probably the one thing I'd never thought about the late Queen, but I mean, yeah, she was a complete warship in her posture and demeanour.
But you know what? She had a lovely posture, but her breasts, she had beautiful tailoring, but I always thought she needed a breast reduction.
And actually, just to link that anecdote back to confidence as well, they say that a breast reduction is the main surgical procedure that actually does restore confidence. It's the one that gives the greatest quality of life back to the patient.
You're absolutely right. At any age, I have had young girls, and I don't operate on anyone before they're 18, so I've had 17-year-olds and their parents are emailing me, can you see her beforehand so she can have surgery on her 18th birthday? No, I can only see her when she's 18. And then I've had 70-plus-year-olds coming and saying, I've always wanted a breast reduction all my life. Is it too late? And I've done the surgery and they've come out and said, oh my goodness, I wish I'd done this decades ago. So you're absolutely right. Out of all cosmetic procedures, looking at breast lifts, breast bigger, mastopexy, breast uplift, noses, whatever. When you look at the plastic surgery surveys of patient satisfaction from procedures, breast reduction is the one that women gain most benefit from psychologically and physically. So the typical large-breasted woman comes in like this. If they're young, they've got a hoodie and a big sweatshirt. And if they're old, they probably have a cardigan or a cape or something. And I say, what would you like to achieve? And they say, I want to have, number one, weight off my back. I've got back pain. I've got grooves in my shoulders. I've got rashes underneath my breasts. And I'm hunched. And I just really want to get rid of all of that. And I say, okay, so yes, we'll make sure that you're fit and healthy and you're at the ideal weight that you want to achieve to keep for the rest of your life. And I'll go into why I tell them that. But we prepare them psychologically and make sure that they're fit for surgery. And I say to them, I may not get your back pain solved, because it could be a posture thing that won't change with just a kilo off your chest. The grooves in your shoulders may take a long time to resolve, and you still will need to wear a bra. Yes, hopefully the skin will heal, but I'd like you to think about what you want to achieve when you come back for your 3-month appointment. And while you're coming in like this, I'm sitting like this now, I want you to work with me so that after this operation, you are going to come walking into the clinic like this, as if you've got a string on the top of your head pulling you up and a book balanced on your head. And I want you to come with your nipples pointing forwards. And I tell them that, and I can because I'm a girl. And
That's so true. One feels very safe in your
difference
company.
between a man telling a woman what she might, what the result might be and what he wants for her. But
That's
I
so
can
true.
actually say, this is what I want us to work towards.
But how interesting as well that you're so attuned to the postural effect of that procedure as well, because it's a procedure, obviously the breast reduction, that sort of reinstates confidence because it makes you look different, but it also makes you feel different because you suddenly don't have that weight on your shoulders and you don't have that sort of stooped, that hunched posture. And I think it's fantastic that you work together with the patient to really promote that.
So there's big breasts, but there are also droopy breasts, because big breasts tend to be very droopy because of the weight of them. And a lot of women don't realize that it's because half of their chest and sometimes their abdomen and their torso is just completely covered by these big breasts. And so when they have the reduction and everything is lifted up, they suddenly feel 2 dress sizes smaller because they can see all of this chest. And you know, they are transformed.
Visually, it changes your dimensions and your ratio, and I think that's something that we have to always bear in mind. I always find it fascinating with breast implants that you don't just go up to a 32C. You know, it's all about the sort of the shape of your own body, your own anatomy, understanding that and understanding how to create that ratio that gives you confidence again.
So breast augmentation is a completely different thing, because women of all ages come to me for breast augmentation. Young ones who don't develop. I had a breast deformity and small breasts as I was growing up, and in fact I only had my surgery, breast augmentation with my own tissue, although I think I went into plastic surgery and breast surgery because I wanted to find out all about my options for myself, and then I could choose my surgeon by working with them. But anyway, that's beside the point. But coming back to breast augmentation, all ages, and sometimes it's not just breast bigger, it's breast shape and how to achieve that. And it's trying to understand what that particular person wants from that operation. And sometimes I say, well, actually, you know, it's not surgery that you need. It could be psychological counseling, because I've had patients with body dysmorphic disorder, BDD, and they've got beautiful breasts, completely normal. And I often say to them, maybe not. And I wouldn't advise that you go to another surgeon, but maybe seek counseling. And sometimes they get really, really upset, so you have to be a psychologist or psychiatrist as well. Young women, small breasts, implants or fat. The other age group that women come to very commonly is after breastfeeding and children, where they might have had a nice volume, but everything sort of shrinks after the skin is stretched, and they feel they have lost volume, especially here. And of course, with the weight of the breast, with the engorgement during breastfeeding, everything goes down south. So the whole breast footprint, as it were, position on the chest wall, will descend. and then there's usually a dip here. And a lot of women who have lost a lot of weight and had lots of stretching then want more fullness in the cleavage area. So some women can get away with just breast volume augmentation, but oftentimes they might need a skin reduction uplift mastopexy as well. And then in the older age group, after the menopause, the breast is made up of breast glandular tissue that's under the influence of hormones and fat, and it's all held together with fibrous tissue, your ligaments of Cooper, that stretch as well as you grow old. So as you grow old, your skin will have less collagen and elastin. You lose about 1% each year. Am I right?
Always terrifies me.
Yeah. And then your ligaments of Cooper will stretch as well. But the ratio of the breast tissue that is firmer, that you had a lot of as in your younger days, is replaced by fat, which is floppy. So
you don't have the structure and the
you
shape
end
anymore.
up with lax skin, floppy breasts, one pillow and one blanket.
Aging is such a positive experience.
So anyways, and so yeah, all
It's so
ages.
interesting as well because you're pointing out these very key milestones in the female sort of lifespan as well: pregnancy, breastfeeding, perimenopause, menopause, and it seems that not only do we physically change as a result of these milestones and these chapters of life, but our confidence is getting knocked with every time as well.
But do you know what the greatest bugbear I have is what we're sold of as normal breasts. And I can tell you, in the 30,000 pairs of breasts I've seen in my lifetime, I can count on my hands the number of people who have beautiful breasts, without surgery, that is. So, do you know what? After the age of maybe 25, everything starts to descend. And, when women come to me and say, I want to have the perfect breasts I had before I had children, I'm going, I'm sorry, I'm not your surgeon. It's just not possible. So
You have something to say?
Next.
Yeah, you can
Next
have
question.
implants, yes, and you'll have a good result, but the implants will drag on your skin. You can have fat to cover the implant if you don't have enough soft tissue, because one of the greatest problems with breast implant surgery is having enough soft tissue cover to cover the implant, because if you don't, you'll see the outline and the surface of the implant. So 2 ways to increase the soft tissue cover: put the implant behind your pectoralis major muscle, or put some fat over it, fat transfer, or you do both. There are pros and cons of each. The thing about silicone gel implants is that silicone gel weighs more than fat, so if someone has got enough fat, it is a good option. Fat has regenerative properties. I love fat, you know that. And it also is lighter than silicone gel, so I often use a combination.
That's also really nice on the note that it is lighter as well, because I guess that means you don't end up with the drag and the heaviness over time, so almost more sustainable, more sort of long lasting, could we say?
If your fat survives where you've transferred it to, it will be there forever, because not only do we transfer mature fat cells but also stem cells, and they're the ones that give signals to that colony to keep dividing. So the caution though, and I normally get this asked this question all the time, if I lose weight after the fat transfer, will I lose the fat? And I normally say, if we have a steady state at 3 months, and that's the amount of fat that will have survived, those cells will probably always be there. But if you eat more, each fat cell in your body, in your breast or elsewhere, will have a larger lipid droplet all over. And when you lose that weight, the number of cells will stay the same in your breast as well, but each lipid droplet will become smaller, so there'll be the apparent loss of fat graft.
So how does this fit in? Because you and I have spoken offline about how somebody who doesn't have much fat on their body, for example, could still harvest enough to do something really wonderful with their breasts.
So there's one paper published in the literature where there was a study of liposuctioning people, and in one group they asked them to overeat for 6 weeks before the liposuction, and in the other group it was a control. And in the group who overate for 6 weeks beforehand, there was an apparent increase in number of cells in the saddlebag area. So it's a very special deposit of fat, only in females, where if you overeat, you have development of more fat cells. So the number of fat cells potentially increases. The question is, and I don't know the answer, and I don't know if anyone knows the answer, if you transfer those fat cells and then lose weight, will the signal actually cause those particular fat cells to reduce in number? I'm not sure. But it makes it easier if someone hasn't got very much fat and they eat a little bit more to get more fat from here. And the quality of the fat from here is amazing compared to elsewhere.
I would 100% be your guinea pig for that, by the way. 6 weeks of eating, a bit more. Suck it all out and put it back in. That sounds wonderful. I also think women are much more sort of emboldened perhaps by the idea of using their own sort of natural resources, so to call it. You know, we get a lot more confidence in thinking, this is my own natural body and I'm very elegantly repositioning my resources to an area that might need it.
That's exactly what I did. So I got my birthday present operation from my husband when I was 40. I'd finished my family, and I actually had a very complex operation that's used for reconstruction, where it wasn't free fat transfer, it was this tissue transferred here, microsurgery. So now when someone says, have you had implants? I go, no. It's all me.
It is. What are the other areas of our body that we sort of start to, I suppose, notice sort of the effects of time, passing of time, sort of, and that we then feel less confident about?
Jonquille, you've covered the face so beautifully. Aging of the face.
She always does.
And you brought up the receding hairline. Oh my goodness. When we age, we don't just have loose skin and we don't just lose the fat on our face, but our whole skull shrinks, which is why the hairline recedes. So
we use collagen from every part of our body.
All over. So in preparation for my patient's surgery, I normally get them to take a 3-week course before and a 3-week course after of hydrolyzed marine collagen with all the goodies that come with the pack, especially for surgery. And it's not just good for healing, reduce swelling, bruising. It's got all the good goodies to promote healing. And it's great for hair and teeth because I take it.
Any other areas of the body?
Skin, oh my goodness, you touched on exosomes. When I went to find out about fat transfer, I went to this conference in Las Vegas. It was 5 years ago. And the passion then was talking all about fat transfer and the size of fat to transfer, whether it was macro fat or if you filtered it to give you smaller particles, micro fat, and then you put it through a smaller sieve to get nano fat. And then they started talking about exosomes, which are the little messengers that fat cells and stem cells use to talk to each other to stay alive and to grow, and how you could harvest them from your fat. And out in the exhibition, there was this Korean company that had exosomes bottled. So I thought, why would I undergo liposuction? Because I had terrible skin, terrible pigmentation, and horrible wrinkles. And even though I'd given myself a Botox injection, don't do this yourself. But I always know when my husband says to me, "Why are you looking so grumpy and tired?" Oh, that's a signal. I need more Botox. So anyway, I thought to myself, I've had the Botox and I still look terrible. I'll try these exosomes. I've been using them for the last 5 years, and I've seen great results for alopecia and hair. I'm so glad that you're going to introduce them. I think that's the way forward.
It's definitely a very innovative sort of part of medicine right now, isn't it? And I think a lot of people are sort of still watching the space. But what I love about Jackie is that she's actually been using this herself, and her skin is testament to it. And actually, look at the backs of her hands, because you've only done one hand, right?
So yeah, that was. Whenever I see Francesca, we have to talk about what we've had done, and because
It's a long conversation.
because I had lots of other treatments over the last 5 years, microneedling and fillers and more Botox and plasma and peels and all the rest of it, plus the exosomes. I thought to myself, I can't unpick this. So what I did was I just used exosomes on one hand, and yeah, everyone says there's a difference. They
There
don't
is.
they don't
Everyone's gonna be
always
coming
get
to
it right.
expect.
I have to say, well, why are you saying that? And yeah, so yeah.
Final question. What are your thoughts on what Jonquille sort of mentioned about ageism and that sort of invisibility of age that happens?
So yes, we're all going to live longer, but do you know what? Look at our late Queen. Look at Helen Mirren. Look at all these wonderful icons that we can look up to, and they are living life to the full. And they're not all having treatments. I still have treatments, and I was told that if you want to go into this aesthetic industry, because I inject and I do facial treatments and exosomes and all the rest of it, you have to look the part. So yeah. If you want to look young, there is regenerative medicine. There's so many different techniques. There's so many experts. Come pick our brains. But if you want to age gracefully, that's good too. But I'm not sure that the likes of Helen Mirren don't have lots of treatments all the time anyway. It's just beautifully done. And I tell you why. It's because when you see bad work done, it's very obvious, and that's what gives the industry a bad name. But when it's well done, you can't tell. And you wonder, why are these people looking so good? It's because they've had really good work done.
Yeah, it's so true. It's a shame that the examples you see that really put you off are not an accurate representation of some of the very beautiful and very artistic and thoughtfully done procedures that do actually take place.
So you don't have to look old.
No, this is true. Thank you so much, Jackie. That was a very apt ending to a conversation all about confidence. You do not have to look old. But actually, I think what it really summarises, and actually I've loved listening to all three of you, because I think all of your approaches overlap so beautifully. One of my key takeaways was just how all of you spoke about positivity, and I think that's such an important thing for us to remember, because we do live in a world where we have access to these incredible treatments and therapies, but actually it starts with us, doesn't it? Every single day. And I often think, people such as yourselves, you spend your days in consulting rooms and treatment rooms, and you do extraordinary work, but that alone is not enough to give somebody confidence. A lot of it starts with ourselves.
Absolutely, and I think that neutrality is really key as well, as a different perspective, that we are not taking and we are not heaping our self-worth as a definition as to what we look like. So for me, I think neutrality is really key. The question, I hope you don't mind me kind of jumping in, was for Jackie. I'm really interested to hear how you have seen differences of how women are wanting breast shape and size. When you said about the ideal breast, you've counted it on your hands over the years of 30,000 breasts. Has it been significantly changed over time with the influence of the porn industry and social media?
I'm not sure when porn kicked off, but more recently I'm seeing women who want more perfection, and it's a long consultation when I say, you know, you're going to end up with sisters rather than twins. And what you see in the media, on social media, in the magazines, there used to be page 3 of the Sun, now no longer, thank God. But those aren't what real women's breasts look like. And you see, you don't get a chance to see what other women's breasts look like all that much. I suppose if you, and you know, we used to go into the changing rooms and people used to get undressed in a communal changing room, so you might see other women's breasts. And I suppose the last time you saw women's breasts were when you were in the changing room in school, in your swimming pool. But as grown-ups, very few people go topless on the beach now even. When I was 18, people did. And you know, we used to be a lot more liberal, I think. So if you went to a nudist beach and looked at women's breasts, you'd realize that actually you've got normal breasts, and the aging process will make them droop. And I suppose when I see women in the clinic, even for cosmetic consultations, I start with a breast examination for health, and I look at them with their arms up and down and from side to side, and we did a breast examination at one of these beauty triangle things about breast health. And with so many of us going to get breast cancer, 1 in 8 or 1 in 9 by the time we're 90, it's important to emphasize breast health as well. So when I start the examination, and then when I say, okay, so first things first, your breasts feel normal, they do actually feel a sigh of relief. And then we go on to talk about their measurements and proportions and what they want to achieve, and I do that with them in front of the mirror. But we have to be thankful that we've got healthy breasts. And I often say, if someone is looking for a mastopexy who won't get a very dramatic change, you're going to have scars around your breasts, around your nipple areola. At the moment, they are unscarred, they're fully sensate. When you cut into the skin, there are little nerve fibers that provide sensation. The healing process is usually good. Those little nerve fibers are small, and the scars aren't, you know, everywhere. But sensation can change. It can be heightened, it can be reduced, it can be lost. These changes may be temporary or permanent, not just touch, temperature, or pressure, but think about sensual and erotic sensation around your nipple if you lost that. And I normally say, think about how important is that will be for you if you have this operation, and it only lasts a few years, and then you'll have to have a repeat. So going under the knife is serious stuff.
It is, but I also like how much you've underlined the importance of, I suppose, keeping things in perspective a little bit as well, and not falling into the trap of perfectionism. And again, I think all of you touched on this, but actually it's more about being the best version of yourself through whichever means feels right to you. But also, you know, I love your quote, you know, 30,000 breasts, and you've only sort of seen on one hand how many, you know, supposedly normal ones. Fine, 2 hands. There's still a lot of breasts to have been looking at. But I think it really does summarise the talk in that sense, that confidence is not just about what we're finding in the consulting room, it's also what we're gaining ourselves and what we're building ourselves towards self-esteem.
So just some Insta tricks if you want a really nice breast. Don't go face on, go quarter, stick your breasts out and lean forward, and use your opposite hand to sort of push them together for cleavage. I get these photos brought into me and they say, I want to look like that. And I say, okay, so if you stood like this,
I will show you how to style it.
different.
Oh my God, that's brilliant. That's such a good trick. I think that leads us really neatly onto our question and answer section. If anyone does need to scoot off, please don't forget your goodie bag. They're all sort of waiting by the door with the amazing Viviscal supplements in. And also do drop off your referral cards with us on the way out. Were there any questions from anyone in the audience? Yes, lady here.
I was just wondering, do you actually think that bras do prevent the drooping of breasts? Because there was a study and they were like, apparently underwire is very bad.
So any support will prevent stretching. Support is good. Underwires are fine as long as they don't. Your bra has to be well fitted. You must not have anything pressing on your breast tissue, because that will stop the blood flow and lymphatic flow. So wearing a bra is good. Whether or not
Also a well-fitted one, right? Isn't it
It needs
a
to be
fact
well-
that we're all wearing the wrong size bra?
So a lot of bra manufacturers just want to make you feel good. So if you go into Victoria's Secret, I'd be a 32D or E. If I went into Marks and Spencer, I'd be a 34B or C. And God knows what else the bra manufacturers would say. So even if you go to a bra manufacturer, within the different styles, you will probably have a different size. So try on the bra before you buy it. It needs to be comfortable. It needs to not press on your breast tissue. It needs to be adjustable and comfortable and give you the look that you want.
Absolutely. This lady here.
Thank you all, just all so fascinating. With regard to kind of going back to the issue of bras and kind of breast health overall, without going down the road of surgery, just by being a healthy weight, doing exercise, doing things like chest press or any kind of weight bearing exercises, can you still have a very healthy, I mean, aesthetically pleasing breast, even in your 80s, 90s?
We're all living so much longer.
Francesca has the answer. She talked about anatomy. And so the other thing is genes. So if you've got a really good shaped breast or chest wall on which your breast base sits, and it causes your breast and nipple to project in the right direction rather than in or out, depending on the curvature of your hemithorax. So that's one. If you build up the muscle, the pectoralis muscle, by doing your, the exercise, I must increase my bust. Chest press, that will give a good volume on which your breast base will sit on. And then it comes to consistency, whether it's mostly glandular, which is firmer, or fatty. So after the menopause, the glandular tissue will turn into fat. And then it's to do with genetics and care, because that's the amount of collagen and elastin you have in your skin and your ligaments of Cooper. But you know what? Look at all those healthy African women who never wore a bra in their lives. They've got really healthy breasts. They're all down here. They don't have that 45, 55 shape with the nipple pointing, sort of 10 degrees above horizontal. But you know what? They're healthy and they're beautiful and they are super confident women. What are we sold?
It's about being happy, isn't it?
And that's the point, isn't it? I mean, if those African women, how many of their African partners, be it male or whatever, probably, have been subjected to perfect looking westernized breasts, which then is having a huge impact on what women are perceiving that they want, and that's what I'm really interested to know about,
Can I just tell you a story about an article I read about one of the journalists who had a breast reduction and she paid for it and she chose her surgeon and it went swimmingly. And her conclusion was, men don't really care what you look like. They're just happy to get your clothes off.
I'm not sure. I don't agree.
No,
I don't agree
male
at all.
gaze is so,
I think
especially
it's
like young
changing.
boys. Like I've got a friend who, no, it was a friend's brother, and he basically doesn't find normal women attractive because he only follows influencers.
Exactly.
And now he goes out thinking, why don't these girls look like the girls on my feed?
Exactly.
Because
my
it's
point.
starting from such a young level now. It's almost
So
systemic in how you need to educate people
like,
now.
I want to look like that, otherwise the men aren't going to want me. So it's so
Exactly,
sad.
and that's why I feel so strongly about this younger generation, the Gen Zs and lower, because their experiences are so subjected to a completely different beauty image standard that it's not that, oh well, they're kind of happy to just have the clothes off. They're starting to base it upon a different norm.
But that flies in the face of this entire conversation that we're having, doesn't it? How on earth can we cultivate greater resilience and confidence if we're always going to be undermined by what social media and the pornography culture is going to tell us?
Interesting, isn't it? Because this journalist was in a steady and very loving relationship with her husband or her partner, and she was of an age where I suppose, having a night out and having sex at the end of it was actually a treat, whereas young boys in their teenage years, they expect it every time they go out, every weekend or whatever. I think is my interpretation. I've got a nod.
I agree, but I think it's been so insidious now that it's really affected actually the millennial male generation, and therefore the millennial females and the Gen Zs.
And the question is, should we pander to it?
Right.
Or should we try, well, I don't want to judge, but should we demonstrate that there is a different way?
It's difficult because we're also in an era right now where we're told that we can be whoever we want to be, and we can be, if however we identify, however we want to be perceived, however we want to present ourselves, that is within our grasp now in a way that it has never been in previous years.
But bummer, that's so bad for our business.
Yeah, that is true. I can't argue with that. Were there any other questions, this lady here?
Yeah, so I've had various problems, health problems, and hair thinning problems. So I had a menopause like 4 years ago, and last year I had bowel cancer and was through chemotherapy. And as you said about the drain, the hair falling out, it was just horrendous. And the texture of my hair completely changed.
It does,
Yeah.
It comes back a different colour,
Yeah.
different texture.
Yeah.
And people don't realise, because I do a day in clinic, 1 day a month with cancer research, and I do a whole day of free clients. We consult them who've had chemotherapy.
Yeah.
And everyone's like, well, why do you do that? Because their hair grows back. It never really does grow back the same. Your hair colour actually goes darker. It can come back a different colour. It can come back coarse, dry, thinner.
Yeah.
And what I noticed with one of my best friends who had triple negative breast cancer, stage 3, and she got COVID and almost died. She actually lost her complete hairline. It's gone. And it was all due to the chemo and all the radiotherapy that she had. So your hair never really comes back the same after chemotherapy, and people don't realise that.
And the thing, it's improved a lot. I didn't want to go out. It was
No,
just,
it affects everything.
Oh, and I had thinning hair anyway. And I went to Macmillan at the hospital, and I did see the wig specialist.
Yeah.
And I tried on a few different wigs, and I don't know, I just felt too wiggy. I just felt
You can tell it's a wig a lot of the time. That's the problem.
Yeah, and I felt even more self-conscious. So I decided just to use like a spray.
Topical powder spray to cover the scalp.
And
Yeah.
that's what I did to get out the door.
Yeah. So
That's
it does affect
Whatever
you in
gets you
every
out the
way.
door, it's such a
Exactly.
good expression.
It is. It literally helps me face the day.
Yeah.
But I was chatting to your PA, really interesting discussion, and
I can see you two are getting on really well. I think you're booking an appointment. I feel it.
It's good energy
I've been
going
told
on
October. Yeah, exactly.
October, I can see you. Yeah.
I've been in touch with another very well-known trichologist and his daughter.
Yes.
And I mentioned about what happened with me, with the bowel cancer and the treatment, blah blah. When I was desperate, because I did feel horrendous, let alone getting over the trauma of everything,
Yeah.
coming to terms with it, and then
Yeah.
the hair.
Yeah.
And she said to give it a certain time frame before you have the bloods and before you come and see me, because it will, after chemo, you have to sort of give it.
I guess
6
you want
months or
time
so.
for it to all get out of your system.
Yeah.
In a way, but like I said, my best friend who's had breast cancer, this has been about 2 years now, and her hair has improved slightly because I've been treating her, but it doesn't just go away. It's like with menopause as well. After menopause, your hair never really is the same. Even after having a baby, your hair really doesn't really go back, no matter what anyone tells you. So it can improve, but it won't go back to how it used to be. It will be a lot drier, as I said. Your hairline will be receding, could change colour. So it doesn't matter how long you wait. It just won't go back the same.
But even knowing that is good.
Yeah.
That can give you
Yeah, definitely.
confidence as well. Oh, thank you. Were there any other questions from our lovely audience?
Can I just also ask about hair? You mentioned earlier about having good hair routine.
Yes.
So could you just maybe elaborate on that and what you would say is a good routine?
Good routine is washing your hair. So a lot of people don't actually